concerned are you that they haven't come forward to take these vaccines?
No, the uptake of second dose vaccines has been really, really good. In fact, to be honest with you, it is known that there are normally a number of dropouts with the second dose of any vaccine. But our numbers are quite good in relation to second doses. It's just that we went ahead with the first doses because we had the vaccines to be able to do so. But there's no issue there in relation to persons coming back for the second dose. And we are still in the process of administering second dose vaccines. So that, I don't see that as an issue at all. And as far as the other vaccines are concerned, I can't give any timelines because we have been given several timelines before and things have not been working as indicated by those timelines because we still have issues with getting the vaccines in from the manufacturers and from the countries, and we still expect the last tranche of the COVAX vaccines, which is another 33,000, and we are awaiting word on when they are likely to arrive. We are still waiting to see what happens in relation to the donations by the President Biden administration of vaccines to CARICOM countries. But we don't know again when those are going to arrive, and we are still pursuing the other angles that we were pursuing before and awaiting a large shipment of vaccines which we really could do with tomorrow, but we have no control over the arrival dates and timings for those vaccines.
Okay, you remain concerned as well about the slow uptake of the Sinopharm vaccines?
I think that we have to do a lot more public education in relation to the Sinopharm vaccine, because you would recall a lot of work was done by the press and also by us as far as AstraZeneca and Pfizer and one or two of the others are concerned. But we have not done enough to promote the Sinopharm vaccine, and that is in train. And we discussed that at the EOC and at the ministry, and we are going to be addressing that issue going forward.
Also, what's your response to queries on Pfizer, Moderna, and Johnson & Johnson? Because a lot of people have said they're waiting for those to get here before they decide to take the vaccine.
I would say people should make use of whatever vaccines that are available for use in Barbados, bearing in mind that all of the vaccines that we have are vaccines that would have been approved for emergency use by the World Health Organization. And those vaccines are what we have available. Those are the vaccines that people should use, because there's no guarantee in relation to the arrival of any of the other vaccines, because that's the nature of the beast that we are fighting at this point in time. This is a global issue, a global problem. And so it would be better for people to take what is available. I have taken the AstraZeneca vaccine because that is what was available. If I had not been vaccinated when the Sinopharm vaccine arrived here on island, I would have taken that, because the efficacy of that vaccine gives me comfort in terms of being able to fight off serious illness as a result of COVID. And that goes for all of the vaccines that we have approved in Barbados based on the approval of the WHO, World Health Organization, and those vaccines that have been made available to Barbados. So I don't think that people should wait. Even with the AstraZeneca vaccine, which we've had most of, we are not in a position at this point in time to say that we have stocks of AstraZeneca vaccine in store, because we are waiting arrivals and have been for a while.